Okay, last time we talked about some diseases of the GI tract. We talked about GDV, or bloat, that can happen in dogs, and to some extent in a different way in ruminants. Another thing that we need to be concerned about with the digestive tract is the use of NSAIDs. What does NSAID stand for? Non-steroidal anti-inflammatory drugs. Okay. Can you give an example of an NSAID you would use for your own health? Like Advil, ibuprofen. So there's a lot of different NSAIDs, and we use them to treat inflammation. Okay, if you've got a headache, okay, you can use an NSAID. If you have joint pain, you can use an NSAID. And they reduce inflammation and pain by reducing the synthesis of prostaglandins. So there are some, quote-unquote bad prostaglandins that cause pain, but it's important to know that there are also prostaglandins that maintain the health of the stomach lining. And the stomach lining is important to maintain its health because why?
So your acid doesn't burn through the organ.
So the acid doesn't burn through there, so you don't have an ulcer, right? The lining has to be replaced every 5 to 7 days, and if something impedes that, we can get ulceration, which in some instances can be life-threatening or at least require surgery to repair if you have a really bad ulcer. So we have all different types of NSAIDs in the veterinary clinic, not as many as we do for human use, and you never usually want to use a human NSAID on an animal. There might be an exception or two, but by and large, Rimadyl is an NSAID that we use for dogs. There's an injectable and also a pill form, and it's quite expensive. A bottle of this was like $100, and for something like this, we're like $60 or $80. So the drugs are a lot more expensive on the animal world than going to buy a thing of aspirin or something like that. Banamine's one that we use for large animals, and then just in the last few years, there's been some NSAIDs released that are specifically for cats. But all of them still could have GI problems. And so it's important to know that if you're treating an animal with an NSAID, be aware if it has any other types of gastrointestinal issues. You don't want to exacerbate them. The other thing is never mix an NSAID with a corticosteroid. So never give prednisone at the same time you're giving an NSAID. That's just a recipe for disaster. Okay, so we're going to take a break before we go look at the small intestine and talk about some of the accessory organs. These are organs that are not part of the GI tract, but they still secrete something that goes into the tract, or they store stuff that comes out of the tract. And so this includes organs such as your pancreas, the gallbladder, and also the liver. Okay, the pancreas. Pancreas on your body is on the right side. It's in the duodenum. Okay, here's your stomach, there's the duodenum. It has different anatomical parts, and we're not going to worry about that so much. But what is the main functions of the pancreas?
It regulates hormones.
Regulates hormones, so it has an endocrine function. It regulates two hormones, principally we're talking about insulin and glucagon, and those control what? Blood glucose levels. And we'll talk about that when we get to the endocrine system. So it does have important endocrine functions, but those aren't digestive functions. In addition to having these endocrine functions, it's a very important producer of digestive enzymes and digestive secretions. When we looked at the stomach before, and we talked about the pH in the stomach, what was the pH there? 2. So pH around 2. Now, once we enter the duodenum, one of the things that you can imagine the pancreas being right here, and it has ducts that lead right into the duodenum. One of the main functions of the pancreas is to secrete bicarbonate, HCO3. And what is that going to do to the pH of what's in the intestine? Make it higher. It's going to bring it up. Okay, so it's going to buffer the pH, bring it from a very low pH of 2 up to 5 or 6 or so. So it's going to buffer that pH. Now, as we shift the pH from 2 to 5, how is that going to affect the enzyme activity from the stomach enzymes? They're not going to function very well. So basically, since we're switching pH, we need to make all new enzymes. Enzymes that work well at a pH of 5 or 6 or something like that. And so that's one of the jobs of the pancreas, is to make more protein digesting enzymes, more lipid digesting enzymes, etc. Okay, Okay, so we have sodium bicarbonate. That's there to buffer the pH. We have an amylase, pancreatic amylase, to digest starch. Again, this is in our animals that are either omnivorous or are herbivorous. And then we have a suite of protein digesting enzymes. The main one you need to know is called trypsin. Okay? And there's chymotrypsin and carboxypeptidase, but the main one you need to know is trypsin. This is a very powerful protein digesting enzyme. And then we have a pancreatic lipase. It's a very active enzyme to digest lipids. Of all the lipases in the body, the pancreatic lipase is the most effective. Okay, and then we've got a ribonuclease, deoxyribonuclease. What do you think they break down? DNA and RNA. Okay, so you don't have to worry about the DNA of your food getting incorporated into your DNA because we do break it down, right? Okay. All right, so the important thing about the pancreas is that, again, it's a combination of endocrine and exocrine tissue, but the majority of it is devoted to exocrine tissue. So if we're looking at a cross-section through the pancreas, and you're looking at a big thing of pancreas, most of the tissue in there is exocrine. And every so often, there's a little cluster of cells that are called the islets of Langerhans. And those are the cells that secrete insulin and glucagon. So when we have an animal that's diabetic or a person that's diabetic, these are often the cells that are affected in these islets. Usually the other cells are not. That being said, can you think of a disease or disorder that affects the pancreas, that affects dogs? Pancreatitis. Okay, what does that mean? Inflammation of the pancreas. So it's not very fun because when the pancreas gets inflamed, it gets obstructed, and the enzymes like trypsin actually begin to auto-digest parts of the pancreas. So you can imagine it probably doesn't feel very good. What are the predisposing causes of pancreatitis in dogs? Fatty foods. And we're not just talking about like one thing. This is when your dog gets into something, or it's a small dog, gets a lot of fat. We had, okay, now onto the liver and gallbladder. Now what does the liver in your body do? It is a bioconverter, okay? Because your body needs so many different types of molecules, and you're not necessarily ingesting that perfect match of molecules, but your liver can synthesize a lot of molecules from other molecules. Case in point, if you think about the fact that, how many people in here have been on the Atkins diet? Anyone? Okay, so if you're doing the Atkins diet right, you're eating no what? No carbohydrates. And that's fine. Your muscles they don't need carbohydrates, other portions of your body. Your brain needs to live on glucose. So somehow your body is able to take the proteins and the fats and convert those into carbohydrates. And that's what it does through the process of gluconeogenesis. Your liver just takes those fats, converts them into carbohydrate. When I was, in grade school and stuff back in the 80s, it was different. It was, instead of the all-protein diet, it was the all-carb diet. Because they thought, if you're not eating fat, you can't get fat, right? Is that true? No. If you love pasta as much as I do, I can tell you that doesn't work. So if you eat too much pasta, your liver can take that carbohydrate, convert it into fats, and those get stored in the body. So it is a very important bioconversion organ. It also detoxifies drugs and sometimes activates drugs. There are some drugs that really aren't active in the body until they're metabolized by the liver. Prednisone is one that if you don't have the enzyme in there to be converted into prednisolone, then you don't really get the therapeutic effect. So cats don't really have the enzyme, so they give them the metabolized prednisolone. It's also important to know that if the liver's impaired, that can affect how long drugs last in the body. So if one of the functions is to break down drugs and excrete them, if the liver's not working as well as it should I give this animal more drug or less drug? Less, right? Because it's impaired, and more drug is going to last for longer than it should. Okay, so that's good to know. Another function of the liver is to produce bile. Okay, bile is pretty important. We'll talk about in here in a minute as an emulsifier. The liver is the largest internal organ in the body. If you opened up your cats now? Yeah. Did you get to see the liver? Did you see the fat flap, the greater omentum? Okay, all that. All right. So It's a pretty impressive organ. If you see a liver in a person, it's tremendous when you get to open up a human cadaver. They're huge. The liver is unique in the way it's plumbed into the circulatory system. So all the nutrients that are absorbed in the small intestine are transported to the liver by the hepatic portal vein. A portal vein is basically a vein that connects two capillary beds. So the capillary bed in here where we have absorption of nutrients, and that's transported to the liver. And again, the liver is going to bioconvert things. If we have an excess of carbohydrate, it's going to convert that carbohydrate into fats. Okay? If there's a dearth of carbohydrate, it's going to help break some of that it's going to help break some of the fats and other molecules down into carbohydrate. Okay. Now, the other thing that the liver does is it makes bile. Okay. Bile is that green sort of liquid you've probably seen, you know, when an animal throws up, sometimes there's a bile coloration to it. Now, bile is important for emulsification of fats. It doesn't break down fats. It's not like an enzyme, but it does emulsify it. What is an emulsifier?
Does it dissolves?
It helps to dissolve. Yeah, I'll give you an example of, everybody knows what store-bought peanut butter looks like, right? Okay, what does the natural peanut butter look like? It's got the oil on top and the solid stuff. It separates, right? So an emulsifier helps to suspend a fat in an aqueous liquid. So if you've got, you know, a frying pan in the sink and it's full of grease, and all the grease tends to, you know, a little water in it, but all the grease tends to stick together, right, in a big glob. And then you put a drop of dish soap into it, what happens? Yeah, it sort of separates and they go into smaller globules and they go to the sides of the pan. The fact that I've broken it down from one big mass into smaller globules, what does that do for us that is going to help with digestion?
Easier to break it down.
But why is it easier to break it down? What have we created more of? Surface area. Okay, so by emulsifying this big glob into smaller globs, we've created more surface area so that when we get into our intestine, our enzymes can work more easily on that. So even though bile is not an enzyme, it's still really important for digesting fats. The point is the gallbladder does not make bile. So you're still making bile even though you don't have a gallbladder, but you don't have as much around for that one big time when you eat a fatty food. Like there are times in the gallbladder it has smooth muscle in there, so when food passes into the intestine, it will actually go squirt and a big dollop will go into the small intestine to help with emulsification. So yeah, you're still producing bile even though you don't have a gallbladder. The gallbladder just concentrates it. Interestingly enough, you can get, and dogs can get, cholelithiasis. What is that? What does chole mean? I'm talking about the gallbladder. Litho mean. So it means stone. So gallstones, right? Okay. Because the bile is made up of cholesterol, it's also made up of biliverdin, which is a green pigment that came from the breakdown of red blood cells. And so that cholesterol can precipitate in these little stones, and you can have 15 or 20 in there, and they can block the gallbladder.
That's why mine was taken out.
So now back to the GI tract, the small intestine. The main function here is absorption, although digestion continues to happen as well. Okay. It has a large surface area due to its length. This is not the length because it differs on the animal, but despite being called the small intestine, at least in monogastrics, it's actually the longer of the two intestines. Okay? It's really long. It has these circular folds on the inside, and then within the circular folds, we have little structures called villi, these little finger-like projections. And if we look at the cells that make up those villi, they have what we call the Bart Simpson haircut, and so they have microvilli. And all these things help to increase surface area, so that's going to help enhance absorption and also secretion of enzymes. So this is the brush border, those microvilli on top of one cell, and you can see there's just so many microvilli, and I think we said 200 million per square millimeter. So lots and lots of surface area. This would be like a really fine shag carpeting. And so there's a lot of surface there for not only absorption to occur, but the enzymes within the intestine are actually embedded in the brush border. And so as, let's say, a protein molecule bumps into one of these microvilli, it would be broken down into individual amino acids by the enzymes embedded in it. Okay. So earlier on we said there's two types of digestion. There's mechanical digestion, which is like the agitation of a washing machine. There's chemical digestion, where enzymes help to break things down. And part of that was that we had acid. Now, once we enter the small intestine, the acid no longer becomes a factor. Why is that?
Because the buffer
Yeah.
needed to go up.
The bicarbonate buffered the acid, so the acid's no longer the problem here. We're now operating at a pH that's closer to neutral. And in fact, we're looking at herbivores. It can be a lot closer to neutral, and even sometimes a little bit alkaline, depending on the species. Okay, so just remember that the enzymes that we're working in the mouth don't work in the stomach. The enzymes that we're working in the stomach probably aren't working in the small intestine because we've changed the pH. Okay, so mechanical processing in the small intestine. What was the name of the food stuff that enters the small intestine? What do we call that? Chyme, yeah. A bolus is like a ball of food, but chyme is the name for this semi-digested slurry of food stuff. So it enters the small intestine, which is made up of muscle, right? And so the circular muscles in there periodically will separate a large segment into smaller segments, and they'll let that stuff stew in the enzymes produced by the pancreas, and then it will put it all back together again. So it goes through this process of dividing things up, segmenting them, and then shoving them together again. And this just helps to more evenly mix the enzymes and secretions with the food stuff. So it helps to promote digestion. Okay? Just in the same way that a washing machine that agitates your clothes with the soap is going to work better than just throwing them in the water with the soap and hoping they'll get clean. Okay, and then we have something called a migrating motility complex. Once that food is sat in the small intestine for quite a while, we'll have contraction of smooth muscle behind the food and relaxation in front. And so this leads to directional movement of the chyme. And basically we're pushing it from the small intestine towards the large intestine. And this migrating motility complex becomes important once the majority of the nutrients have already been absorbed. Okay. So the cells that we have in the small intestine, do you think it's going to be a simple or a stratified epithelium? Simple. Why simple? Better for absorption, right? Easier to absorb things in the bloodstream. So we have our absorptive cells that are sort of columnar cells with microvilli. We have these goblet cells that make mucus, and then these other endoendocrine cells, two of which you need to know, that make secretin and CCK. We talked about these last time. What did CCK do? Okay, remember that, the stomach could accept a large quantity of food at once. It has a storage capacity, but the intestine doesn't. And so that once food starts to enter the intestine has to have a way to tell the stomach to slow down. And so using these hormones, CCK and secretin, is a way to do that. CCK basically puts the brakes on gastric emptying and slows it down. And so does secretin. Secretin reduces gastric secretions, but increases pancreatic secretions. So these are two hormones, and their main function is to coordinate and make sure that the stomach doesn't work faster than the small intestine. Chemical digestion in the intestine. Well, we have our amylase, produced in our pancreas. We also have brush border enzymes. These are enzymes that are embedded in the microvilli of our brush border cells. So these include things like sucrase, lactase, maltase. ASE, remember, tells us it's an enzyme. What do you think sucrase would break down? Sucrose, okay, table sugar. What about lactase? Yeah, dairy sugars, okay, milk sugars. Now, animals have this as well, right? All mammals, okay, subsist on breast milk. How many people can drink dairy products now without problems? Does anyone not eat dairy anymore? Yeah, I can't take too much of it. As we get older as people, and also as cats, right, and dogs, their ability to process lactose goes down. Some animals become, violently ill if you give them a lot of milk because it causes diarrhea and stuff like that. So just be aware that the amount of lactase produced by an animal does go down, and so that can cause, some diarrhea and other issues if you continue to give them dairy. Okay, so we've also got protein digestion. We've got pepsin from the stomach, but that's probably not working because of the pH change. We've got trypsin from the pancreas, which is working really well. And then the brush border enzymes include aminopeptidase, dipeptidase, etc. I'm not going to ask you the names of these on an exam. You do need to know trypsin. But when you see something called peptidase, you should be able to figure out that it breaks down proteins. How can you figure that out? P for proteins or peptides. Remember that those were proteins as well. So yeah, make yourself up in a mnemonic. That's fine. Okay, now let's talk about lipid digestion. Lipids, otherwise known as triglycerides, is the main one we're talking about. We have several different things that will help us break down the lipids. We have our bile salts to emulsify them, but that doesn't break down the molecule. The main thing that we have that breaks this down is a pancreatic lipase. And so we'll take our triglyceride, which is 1 glycerol plus 3 fatty acids, and we can break that down into a monoglyceride plus 2 free fatty acids. Okay? And the important thing about the GI tract is to realize in order to get food out of the GI tract into the bloodstream, it generally has to be broken down into the single building blocks, right? Monoglycerides and so forth. If it's not broken down, it's usually not going to be assimilated. If it's not assimilated, it's going to stay in the digestive tract and be pooped out. Now let's talk about absorption of carbohydrates. Like, most of the absorption happens in the small intestine, we already talked about. Carbohydrates have to be absorbed as monosaccharides. Okay, so if we have lactose out here, it has to be broken down into monosaccharides. If it's not broken down, it stays in the GI tract. And when it's in the GI tract, it acts as a solute. And what do solutes do? They suck. So it's going to suck water towards it. And so that's what creates some of the symptoms with lactose intolerance, is we just have, loose stools or, diarrhea. Okay, let's look at proteins. Again, proteins have to be broken down into individual amino acids or dipeptides. They can't be absorbed as whole proteins. Okay, if they're not broken down, they can't be absorbed. And now let's look at lipids, because that's a little bit more complicated. Once we break down that lipid using our lipase, it has to be transported in something called a micelle. A micelle is just like a protein vesicle that transports it into the epithelial cell within the intestine. And once inside that epithelial cell, that disassembled triglyceride will be reassembled, put back together, and then encapsulated in something called a chylomicron, which is a protein shell that will help make that fat or triglyceride soluble in the bloodstream. Okay. Now what's interesting is these chylomicrons are so large that they cannot enter the blood capillaries that are in the intestinal villi. Instead, they hitch a ride on the lymphatic capillaries. The reason they can hitch a ride on the lymphatic capillaries is because they're much larger in diameter. So they diffuse in the lymphatic capillaries and then move into the lymphatic vessels. And then from the lymphatic vessels, they eventually drain into the lymphatic duct, which drains that lymph back into the bloodstream. So eventually, these chylomicrons do get drained back into venous circulation and eventually travel to the liver. And the liver is going to decide where they go. Yeah. All right, so this is just showing that those capillaries that absorbed the lipids within the lymphatic system were actually called lacteals. And chyle is just this lymph that is now laden with fat molecules. You can see it. If you were able to draw off some lymphatic fluid, or even let's say you draw some blood after a fatty meal, you spin that blood down and look at the plasma or serum. After a really fatty meal, it's cloudy, okay? So the suspended fats, you can actually see them. All right, so water and electrolytes and vitamins. We absorb a lot of each of these in the small intestine, but also in the large intestine. Vitamins A, D, E, and K, these are your fat-soluble vitamins. So they have to be absorbed with fats. You need some fat in the diet. Whereas B and C are water-soluble vitamins. Okay? And these are important because vitamins are essential to some extent, especially some animals need a lot of vitamin C. Can you think of an animal that requires a lot of vitamin C? Guinea pigs, yeah. I didn't know that. I was on the VT&E. I'm like, what the hell kind of question is this? And Sam's like, guinea pigs. You didn't know that? I'm like, okay, now I know. Now, the interesting thing is that guinea pigs have to have supplemented vitamin C, especially with pelleted foods. But vitamin C in processed foods and pelleted foods has a short lifespan, so it has to be kept out of UV light. At the same time, you have to make sure that that food's in date, because 6 months later it's going to have virtually very little vitamin C in it. So it is important with animals like guinea pigs to pay attention to the expiration dates on the bag. Okay, B12 and intrinsic factor are important for manufacture of red blood cells. These actually decrease if we have an omnivore or a carnivore that's trying to subsist on a herbivorous diet. You can actually become anemic, and so it's hard to absorb enough iron and B12 on a strictly vegetarian or vegan diet. Okay, now we're going to the large intestine, and if we're talking about monogastric animals, the primary function of the large intestine is to absorb some vitamins and nutrients. Mainly it's there to absorb any excess water, because there's a lot of water traveling around with the food and then fecal material, but we want to absorb as much of it back as possible so we don't lose water, because it's a valuable commodity. So here you can see sort of like a representative large intestine for a carnivore or an omnivore. This would be close to what you have in your body and close to what your dog has. So we have a colon, ascending colon, transverse colon, descending colon. Very simple. And then at the end here, what's this little thing? Well, the cecum, we have a little bit of cecum. We have an appendix, right? Okay. The appendix we have is a little evolutionary vestige from maybe when our, your evolutionary relatives, right, the primates that came before you did a little bit more hindgut fermenting than what we do. We don't do anything. We don't do any hindgut fermenting. But if you look at something like a horse, my God, the large intestine is really well developed because, right, the horse is eating cellulose just like the cow. The cow processed that cellulose via fermentation in what organ or organs? No? In the rumen, okay. The rumen, the reticulum, all that fermentation went up in the stomachs. Whereas in the horse, we didn't really have fermentation up there. The fermentation that occurs is in the large intestine, and so that's why it's very well developed, and also in the cecum as well. So horses and rabbits are hindgut fermenters, and we'll talk about that a little in just a few more slides. That being said, for right now, we're not going to consider horses. We're going to talk about the large intestines of other monogastric animals like humans and dogs and cats. So the large intestine is there to absorb excess water, to help with defecation, and also any bacterial production of vitamins that we didn't have before, our B and Ks. Okay, so the pouches of the large intestine, if you look at them in a living animal or an animal shortly after it dies, you'll see these muscular pouches, and they're called hostra. And the purpose of the hostra is to dry out the fecal material as it moves along. So it will move from one hostra, sit there for a while, dry out, and then this hostra will contract and force it up to the next hostra. So hostral churning is a gradual process where food moves through and gradually dries out as it moves across the intestine. Okay, so this is a human large intestine. We've got down here the cecum, ascending colon, transverse colon, descending colon, sigmoid colon, and rectum. Now, in a dog, we don't really have the transverse part, just ascending and descending. Okay, but the anatomy is similar. Mass peristalsis is a process that happens about when food gets halfway across the transverse colon, or in a dog it would be at the junction between the ascending and descending. And this is not a gradual process, it's a very spontaneous and violent process. So you've probably been sitting in class sometimes and the food just going from here to here, and all of a sudden it goes all the way down there, and you stand up and time to run to the bathroom. So it's basically dried out as much as it's going to dry out, and now it's getting diverted down into the sigmoid colon, into the rectum. In fact, the first anal sphincter will often just open up because that's smooth muscle. And so it's just that one ring of skeletal muscle that's standing between you and calamity. But, I mean, think about an animal, and let's say, you know, okay, when it has mass peristalsis and stuff, and it's time to defecate, and you're not home, okay, and it holds it. It's a good dog. And so the feces is going to go back and forth for a while. It's going to go, whoops. Okay. It's going to go back and forth, and as it stays longer and longer in the intestine, the large intestine, what happens to it? It dries out, it gets harder, okay? And so as it dries out longer and longer, then you can run into constipation. Now, what are some other things that can cause constipation in one of your patients? A blockage, certainly if there's something in there that's blocking it. Anything else?
Dehydration in general.
Dehydration, okay. Anything else? Huh? Not enough fiber. Yeah, sometimes, you know, you need to get some fiber in that diet, and fiber is important. Yeah, I don't know if that causes, you know. What I'm thinking about is when a patient's been put on any type of narcotic, okay? You've even seen they have like a new human drug now. It's like, if you're on narcotics and you're constipated, take this Narcopate or something, whatever it was, but it's very common in people and also in pets that once they've been under general anesthesia, or let's say they're taking you know, fentanyl for back pain or something like that, that puts the brakes on gastric movement, or at least on intestinal movement, and so constipation can be quite common. So it's something to watch for in patients that are being treated for pain. I was recently, about a year ago, was at this I guess it's the Motor Museum. It's for like health anomalies, and it's in Pennsylvania. But they had a guy that had something called megacolon, and we can see this sometimes in dogs too, where there's just not muscular contraction in the colon, and it just fills up with poop. And so when this guy died, his colon was full of about 30 pounds of poop. So, you know, it's a horrible way to go. Okay. So mainly the main thing we're having in the large intestine is absorption of water. We also have some production of some really wonderful things like hydrogen sulfide. In horses and cows, we're going to have methane and also some carbon dioxide, which gives them their particular barnyard bouquet. Within the large intestine, the biliviridin and bilirubin, which were yellow and green respectively, get converted into stercobilin. And then we do have some vitamins produced by bacterial fermentation. And excess water reabsorbed. Again, this is just talking about monogastric animals that don't do any hindgut fermenting. Okay, then we move into hindgut fermenters. So here we're talking about horses, and we're talking about rabbits, and some other rodents as well. So rabbits, of course, are lagomorphs, but they digest cellulose, but instead of digesting that cellulose in the foregut like a cow would within the rumen and reticulum, they're digesting it within a very well-developed large intestine. So the nutrients they're getting out are volatile fatty acids that are produced by the protists and the bacteria. And then they also have some bicarbonate being secreted there to neutralize the pH of the large intestine and the cecum. Okay, and with a horse, remember we have a stomach, a monogastric stomach, our small intestine, and then what would this structure be here? That's the cecum, and this is a large intestine. So very well developed in the horse, not as much in the rabbit. The rabbits actually have to do this thing where they have to do corprophagy. Do you know what I'm talking about? What does that mean? They're eating their own poop. Okay, and it's because they do, you know, have bacterial fermentation of that cellulose in the large intestine, but they can't absorb much in the large intestine. You know, most of their absorptive areas in the small intestine, so they have to cycle that poo through again. Now, horses don't have to do that. I don't know why. I'm going to add this is my question for Dr. Kelly, is that, you know, horses can subsist on the nutrients from this hindgut fermentation without reprocessing it. But horses do have a very long hindgut, a very long large intestine. The other interesting thing about horse large intestines is they're very narrow and can sometimes become blocked or obstructed. So what do we call this?
Is that colic?
Colic. You know, colic is any kind of sort of intestinal problem causing pain. Oftentimes it can be a blockage. And again, when horses are eating things, if they're eating grass, they're picking up some grit at the same time. And sometimes that grit can become compacted and actually cause an obstruction there. And so how would you treat that? Yeah, I mean, you can try, various, treatments that are giving enterally that you're saying, well, give some mineral oil or something like that. And if that doesn't work, how else would you treat it? An enema, okay. If it was far enough, yeah, if it was close enough towards the end, you're not going to give an enema and get all the way up here, right? Okay, it's not going to work. That would be one heck of an enema. What's your third option, do you think? Remove it. Okay, doing surgery. Has anyone ever seen a large animal surgery before? Okay, so where did you see a large animal surgery? But a lot of times, if you look at the large animal vet that's here, he has to do a colic surgery or something like that, it's going to be out in the barnyard. And so they might have an inflatable mattress or something like that, but there's not that many large animal facilities here, so they oftentimes are doing it on the spot, doing that colic surgery, and can be removing large masses out of there as well. So again, I'm very ignorant about horses and about ruminants as well. So if you want to learn more about the horse or ruminant digestive tract, definitely talk to Dr. Kelly. But to me, it's just like, wow, it's so weird. How does that work? One last thing that can happen in horses is sometimes the intestine can telescope into another part of intestine. And does anybody know what that's called? It's called an intussusception, and basically just one, like this part of the intestine might telescope into that part, and it can cause a blockage there as well, okay, and cause colic and eventually, death if it's not corrected. So lots of feet problems in horses and also lots of intestinal problems. Okay, and that's all I have for today. Are there any questions?